Hey, I'm Dr. Michael Tebbe with Bright Star Chiropractic. So let's try another option for finding a position to breathe in. Most likely, if you're seeing this, it's probably because you're one of my patients or clients, whatever, and I've recommended this to you. Basically, because of like dysfunction in our pelvis and then the way that our spine kind of adapts to, like this is one theory, the way that our spine kind of adapts is that we kind of like increase our motion here. Basically, we're going to do this thing to help you start like really moving the breath into the back of your body. So many people are really stiff in between their shoulder blades because of lack of movement. And if they try to breathe, they breathe just like up in the chest, but it's not getting back here. The breath isn't moving back there. So this is a way you can help start to loosen that up. So you want to take, this is just like a big beach towel and it's just kind of rolled up. You're going to basically put it right almost like a little bit above your sternum. Like there's a big notch right there. You're going to put a little bit in. You don't want it to choke you at all. And you're just going to lay on it. Like, so any of this breathing stuff is great to do before bed. I'm going to take off my glasses. So I got it right up in my sternum. So you want it high enough that your forehead can just drop and be on the ground. And you're just going to take some breaths here. And you'll feel like I can feel in between my shoulder blades, especially more on the left side because I'm tighter on that side. I can feel like when I'm just hanging out here breathing, that it's letting that area kind of stretch and open up because there's all this pressure on the front of my chest. So the air is going to go somewhere and the movement's going to go somewhere. So I'm just kind of guiding the body and making it move into the back of the ribs. You know, you can even try putting a little bit lower, not too much. So now you can even start feeling it, getting these lower ribs as well, which is pretty much tight on everybody. So play around with that. Maybe just keep a rolled up something next to the bed so you can just do it on the floor a few minutes before bed, because it's a nice way to, one, just kind of calm your system down before you sleep. It's just doing some easy, deep, relaxed breathing. But it's also just helping you get the breath in there and get this whole thoracic, the mid-back area, like all 360 degrees of it, to move better. Because the better it can move, the better you can breathe. Because this is moving, this is what allows to create the negative pressure in the lungs so that the air can go in. So play around with that. It can be helpful too if you're having low back pain, neck pain, to breathe and start getting that area stretched out. Try it out. Thank you.